out to stand together and to fight for what is fair, to educate the public and to make them all aware that much of this is public finance linked to private care. So you please say that it's fair. The lobbyists will try to fool ya. They will think that lies and scare ya. They work for corporations who are surely not your friends, so don't believe their spin. Yay! Okay.
Nice job, guys.
2 years ago, there was a tremendous debate for most of the summer in 2007 about children's health insurance. Should we expand health insurance for children in this country? And of course, Bush vetoed it twice, okay? But every time a proposal came, you know, to really get millions of more children covered for health insurance, the other side would just brand it as, well, that's socialized medicine.
For the Physicians for a National Health Program, Dr. Lisa Millis is with the Minnesota Universal Healthcare Coalition.
That is ensuring that whatever plan we design upholds three basic principles. First, the rising costs of healthcare must be brought down. Second,
what we do would more accurately be called socialized insurance. It's not a government takeover of the private hospitals and clinics. It's not government owning or employing the providers. It's just dealing with the payment of it, the insurance of it. One, it's not true, and then secondly, it kind of gets you off the hook for looking for other cost savings, and we know where the cost savings are. I mean, simplifying the system would save enormous amounts of money, but the electronic medical records, there's no evidence that they save costs, and that's been most recently proven, and that's the word that Obama gets from his own Congressional Budget Office too.
Hear about, you know, virtually all the media that somehow Minnesota does better than the rest of the country. The fact is that we do very poorly here in Minnesota with health care, and we don't have choice.
I mean, the Great Minnesota Get-Together, to me, is symbolic of how we can solve the healthcare crisis. We've got 155,000 people here today at this fair. Let's have everybody in one big pool and share resources, and let's have it be the we, not the me, from us. Now,
this is important, Joel. Let me break in here.
Please.
With regard to what those people did, a nurse and some doctors did, by asking why it's not on the table, why didn't they want it?
You know, Senator Max Baucus and other senators, we know that they're beholden to the drug industry, the insurance industry. That's why we call the term we have for HMO is hand the money over.
Ugly. U-G-L-Y. HMO. You cheat and die. You ugly. You ugly. Greed. G-R-E-E-D. Your premium rates can't fool me. You greedy. You greedy. Evil. E-V-I-L.
Your question is that healthcare costs go like that, and wages go like that, and prices have been, you know, consumer prices have been going like that. So there's this huge discrepancy between healthcare prices, and what I mean by healthcare prices is prescription drug prices, and surgery prices, and the prices doctors charge, and insurance companies, and medical device companies, and you know, the $150,000 coronary artery bypass graft, you know. All these things are incredibly expensive.
I'd like to explain it a different way if I could. It's like if you have a whole pie, and the pie is total health care costs, and then you have slices of the pie, and the slices are the different people who pay for it, and traditionally that's considered government and business and individuals. You can change the size of the slices of that pie without changing the total healthcare costs. So in a single-payer system, you're not changing the size of the pie at all. It stays the same. You're just changing the size of the slices, who pays.
Process, and then you purchase healthcare, and then you might get healthcare taken from her.
It comes down to people pooling resources and healthcare being distributed as a public good versus a market-based system. And guess which one controls the costs? Healthcare is a public good. And
There would have to be a few criteria that a public option would, have to have in order for it to succeed, and for it really to be a strong program that could truly save money and provide comprehensive care. And basically it would have to be huge, huge. If you think of something that's going to compete with WellPoint and United Health and Aetna, it's got to be huge, have huge numbers of people. It has to be able to negotiate with the pharmaceutical company for lower prices. It has to be able to negotiate with providers. So it has to be huge, and it has to be able to negotiate. And then finally, it has to be open to everybody, an option for everybody. And the way that the current, we haven't seen all the bills that'll be coming out of Congress, but the way that the current House bill is written, it doesn't meet any of those criteria.
This is a membership organization of over 16,000 physicians who are especially concerned about a single-payer national health insurance program.
Well, thank you. And some of us, going back, remember when we thought single-payer was going to happen in the 1960s, 1970s. Heck, I was even naive enough to think it was going to happen under Richard Nixon. But we haven't gotten there yet. And over and above that, we support the Minnesota Health Act, which was introduced by Senator Marty and Representative Bly, that calls for single-payer health insurance in the state of Minnesota. And we